It's top of the hour, and it's time for Making a Difference. On this show, we explore people in our community and the differences that they make in other people's lives. I'm your host, CJ Metcale. Today, I am thoroughly excited with my guests that I'm bringing on the show. This is something most of us are in the upper years. I'll just say 50 and over. And along with that age comes many, many vascular problems. And our guest today is a doctor. She is a specialist in vein treatment. She treats aneurysms, carotid artery, spider veins. And I happen to know someone that she made a huge difference in, from having a leg ulcer. They call them venous ulcers on the leg. Those are usually below the knee, and they don't heal. And people treat them with all kinds of things. And this person suffered for over a year and a half with all kinds of treatments. And this doctor came in, took a look, and said that she could help him. And with a fairly simple procedure, which I hope she'll go over, she has cured him. He is almost healed. This has just been within the past month and a half, 2 months, and she has cured him, and he's on the mending road finally after all this time. So, ladies and gentlemen, I almost feel like I need to stand up when I introduce her because she is such an amazing person. I'd like for you to welcome Dr. Michelle DesChamplain, and she has her office in Port Charlotte on Harbor Boulevard. Michelle, come on in and welcome to the show.
Hi.
Hi there. That's her. Oops, I said Michelle, didn't I? Oopsie. Well, okay.
That's okay.
Doctor, we were blessed to get you from Virginia, where you practiced medicine for quite a while, and that's also where you went to school, to the Virginia Commonwealth University School of Medicine, and you got all your affiliate residencies and things like that there. And you were in practice, I believe, for about 18 years before you came here.
I was in practice for about 11 years before I came here.
Okay. All right.
Right. It was 5 years of general surgery residency, 2 years of vascular surgery fellowship. And then I moved to Savannah for a couple of years and then back up to Virginia Beach.
Well, we are very grateful to have you and your skills come to this area. Let me start off by asking, what is probably the most common problem that you treat?
The most common problem that I treat is peripheral arterial disease. And as we age, most of us build up a little bit of plaque inside the arteries. And eventually, in some folks, that can impede the blood flow going down, especially to their feet. It can happen in other areas as well, but usually down to the legs and the feet. And I have several different procedures in my arsenal that can help to improve that blood flow for people. Once the blood flow gets to a certain critical level, that people can develop ulcers on their feet, they can develop gangrene, they can be at risk for amputation. And I have several different ways of being able to remove plaque or bypass that plaque so that the blood flow is improved and people are no longer at risk for that amputation.
Well, this particular, these people that I know had gone up to Sarasota and to a vascular surgeon up there who was going to put some kind of goo in the blood vein that was causing the problem. What is your approach versus putting glue in to fix the problem?
Well, in the case of the patient that you know, that was actually venous disease rather than arterial disease. And so in the veins, What we worry about is when they are not working properly in the legs to drain the blood back up to the heart. And they have a hard job to do because they have to push that blood up against gravity. And so in order to facilitate that process, we all have valves inside of the veins. And those valves segmentally push the blood up back up to the heart. But if in some people, especially people that you see with varicose veins, they have what's called venous insufficiency. And that is what the patient you're referring to had. That's when those valves are not able to close all of the way. And so the blood then backs up into the veins and causes them to swell and become varicose and become painful often. And sometimes people even develop these venous stasis ulcers. Now, there's a couple of different ways to treat that. In the old days, we used to do what was called vein stripping, and that was a very unfortunate procedure because it was very brutal. And many people had it. It was terrible. But then we came along with endovascular work. So now we can put a catheter inside of the vein and do what's called a vein ablation. And we either do that with a laser or we do it with a radio frequency catheter. And it's just two different ways to deliver the energy. And the way I explain it to my patients is that we're basically shrink wrapping the bad vein. So we're shutting it down so that the blood then gets shunted over to veins that are working better, that will get that blood up and out of the legs so that the legs don't swell and the veins don't swell and they don't hurt. So that's one way of doing it. One of the newer ways is to inject a glue type procedure. I am not a big proponent of that one. I still think the research is out a little bit. I think that more patients need to have the procedure in order to make sure that it is totally safe. I've done the vein ablations for 15 years now, and they're very safe. We do everything under ultrasound guidance so that we make sure that we are putting the catheter exactly where we need to put it, and delivering the energy exactly where we need to deliver it. Once we shut down that vein that's not working properly, then the patients are able to heal their ulcers because the blood is now flowing properly.
A question was asked, does this also cause high blood pressure?
This does not. High blood pressure can be caused from a multitude of different reasons, and it can be just simply hereditary or genetic. But one of the things that can cause high blood pressure is a narrowing of the arteries going to the kidneys. The kidneys actually give off a special hormone that helps to regulate our blood pressure. And when they realize that, or they feel like blood flow is not adequate to the kidney, they release this hormone and it causes our blood pressure to go up. So one of the procedures that I also do is to usually put in a stent into that kidney artery so that the blood flow is now opened up and the kidney is reading normal blood flow rather than lowered blood flow.
Wow, this is interesting. Okay, tell me something. Let's take as standard people how do they know that they are on the road to having venous problems, developing venous ulcers? Talk about what the leg does from the very beginning, the first signs.
Well, usually the first signs are some varicose veins. And then some people will develop pain that's associated with those veins. They can also go on to develop leg swelling. And again, leg swelling is another thing that can be caused from a multitude of different reasons, but one of the main reasons is venous insufficiency. But most people, that's how they start, is with the varicose veins, and then they get some leg swelling. They'll start to get some irritation and heaviness in the legs. And many people will try to wear compression stockings, which are very helpful for the swelling and the pressure that they feel, but it's not a permanent fix. And so really doing the vein ablation, which is, once we diagnose the venous insufficiency with a simple ultrasound, the procedure itself really should only take about 15 or 20 minutes to be done. And then they're on the road to recovery.
Does cellulitis that reddening of the skin, does that also accompany this problem?
It does. It does. So oftentimes when the veins become stretched because they're full, they will become a little bit leaky, and they leak plasma, and that plasma has some iron in it. And so oftentimes people will see this bronzing of the skin, or a what we call a brawny type look. And it almost looks like a tree bark a little bit. And so people can develop that, and that skin then is immune compromised, is how I explain it to my patients. That skin, when it's no longer as good of an immune organ as it normally is, because it's been stretched and chronically swollen and been damaged from this venous insufficiency, then it can break down into the ulcerations.
What's your number again? I think I need to make an appointment.
You know where I live.
Okay, let's go on. You treat, what was that? MW-RU. For our radio audience, we are getting some comments on screen, so you'll hear me read some of these every once in a while. Oh, me too. Well, I didn't get that out of me woo. Anyway, as far as carotid,
Mm-hmm.
I know of some people that have had carotid problems.
Right.
What is the first thing that starts happening when you have got a carotid problem, and at what point do you do something about it?
Okay, well, a lot of people are diagnosed with carotid, what we call carotid stenosis, incidentally. The people that have peripheral arterial disease or have coronary artery disease are prone to having carotid artery disease as well. And oftentimes their cardiologist or their primary care physician will do a surveillance ultrasound on their carotids to see if there is some plaque buildup in there causing a blockage. And the way that I tell my patients when they come to me and they have a carotid stenosis is that it's kind of like pebbles in a stream. Eventually, one of those pebbles could break off, and where it goes is up to the brain, and that causes stroke. So the vascular research has shown that if we detect on an ultrasound that a patient has a 70% or greater stenosis in their carotid artery, then they need to have it repaired one way or another. Now, there's several different ways to repair a carotid artery. One is direct, one of the procedures that I do, which is called a Carotid Endarterectomy, where we go in and basically do a roto-rooter job on the artery, clean out the plaque, and close it back up with a patch to make it even a little bit bigger than what it used to be. There are out there carotid stents that have been placed over the past many years, but there's very few patients that actually qualify to have a vascular stent placed. CMS, or the Centers for Medicare, are very specific about the patients that are available to do those stents, and they have been shown to have a little bit higher stroke rate around the procedure than just doing a carotid endarterectomy. So I'm still a big believer in the traditional carotid endarterectomy. I have 2 of them scheduled for tomorrow morning, in fact. It's a very prevalent disease in this area. And I do get a lot of referrals for carotid endarterectomy. There is a newer procedure as well that's sort of a hybrid, where we do a small incision at the base of the neck and then place a stent into that, but that has certain anatomical concerns as well. And so a lot of patients do really, really well with a carotid endarterectomy. It's a procedure that takes about 90 minutes, and then you spend the night in the ICU, and you go home the next day, as long as your blood pressure is under control and you're up and walking and eating and doing all that stuff. So, but carotid disease can be symptomatic as well. So in most patients, like I said, it's just found incidentally. But in some patients, they'll come to the hospital because they've had some kind of neurologic problem that happened, and maybe it's already gone away before they even get to the hospital. Like they'll lose eyesight in one of their eyes for 10 minutes. and then it comes back, or an arm will get weak, or a leg will get weak, or they'll drop a coffee cup because they don't have grip strength in their hand. And those are all signs of stroke. What happens is what we call them is temporary ischemic attacks if they last less than 24 hours. And temporary ischemic attacks are often the first harbingers that you have carotid disease that needs to be addressed. So in those patients that are symptomatic, we actually lower the threshold to about 60% stenosis, and we still go in and fix it for them, and we do it pretty quickly. So if people are starting to have these neurologic events, the new research shows that we want to fix that between 48 hours and 2 weeks after their initial event. And then some are found because people do have major stroke that's due to carotid artery disease. And it depends on what the level of stenosis and what the level of neurologic function and recovery is for the patient as to whether or not we treat them medically or we treat them surgically.
A lot of people take like Crestor, the simvastatin, things
Right.
like that. Does that help with any of these diseases that you've been talking about?
Yes, it does. So risk factors for arterial disease are very important, and they're high blood pressure, high blood sugar. Diabetics get a lot of arterial disease, high cholesterol, obesity, a sedentary lifestyle, heredity. All of this comes into play when we're talking about arterial disease. And so anytime you can moderate the risk factors, then you're doing something good for your arteries. So lowering the cholesterol, keeping your blood sugar under control, keeping your blood pressure under control, and most importantly, not smoking. Smoking is so highly related to vascular disease that it's pretty incredible. And so people who even have a remote history of smoking are more at risk for developing arterial disease than patients that have never smoked.
Let me ask you this. Is it possible to reverse these diseases once they have set in?
I don't know if we know truly that you can reverse it, but you could certainly stabilize it. And again, taking care of those risk factors helps you to do that. So, for instance, with patients with peripheral arterial disease in the legs, we've shown that when people start to develop enough hindrance to their blood flow, they get pain when they walk in their legs. And some patients will not even be able to walk down a city block before they have pain in their legs. And so moderating those risk factors can help that. And one of the studies, actually, that's a very good study, showed that patients that were on a supervised exercise program and walked 30 minutes a day, 4 times a week, supervised, actually extended their walking distance without ever having to have any intervention. And so, and yeah, they did it for about 6 months, and a lot of patients were relieved of their symptoms. So sometimes vascular disease can be treated conservatively, and you don't have to do procedures for patients. And in fact, I will tell a patient straight up, if you're not having pain, we're not developing ulcers, and even though you have a little bit of arterial disease, does not mean that we need to do surgery on you right away. We monitor that, and we do it easily with ultrasound.
You take a pretty conservative approach. You're not shall I say, a knife happy doctor.
That's right. I mean, I am a surgeon. I love to operate. Believe me, I do. It's, my favorite place to be is kind of in the operating room. But I also understand that this is a big deal for patients. Even minor procedures are a big deal for patients. And so if I feel like it's unnecessary or it's not going to be beneficial symptomatically, then I'm not going to do it.
To the audience, I will say that Dr. DesChamplain, she doesn't come across as a money hungry doctor. She puts your health first and considers all of your options before, causing you to have to go through extensive medical expenses. And that's one of the things that that I have appreciated about her ever since I first met her. So, for those of you that are hesitant to go and look into problems you may be having, I would be strongly urging you to check in with her. We're getting another question. Do we have to be referred by another doctor to you, or can we make an appointment and come to you directly?
That depends on your health insurance.
And you
So,
take a bunch of insurance. If you don't mind, I want to run down them real quick. Aetna, Amerigroup, Assurant Health, Blue Cross, Cigna, Coventry Health, Humana Health, Medicaid, Medical Mutual, Medicare, Multiplan, PHCS, Principal Financial Group, and United Healthcare. And those are, I'm sure there's more that you take. Something else that I know that you excel at, this is a county that has one of the larger populations of veterans in it.
right.
And we have a large majority of Vietnam veterans here in Charlotte County, and many of them suffer from Agent Orange. And one of the complications from Agent Orange is the peripheral vascular disease and other complications. And you do take VA, don't you?
Yes, I do.
See, there was one that I didn't list. So
Yeah, and there are more coming on board. I've only been in town for a few months, so it takes a while to become privileged with all of the different insurances, but I intend to take as many of them as I possibly can.
and I found her right after she got here. I couldn't believe what I found when we met her, and I met her, and she treated a friend of mine, and I'm just like, wow. The county needs to know about this, because you, Dr. Michelle DesChamplain, you make a difference in people's lives. And that is what this is all about. For those of you watching on video, we do have her address, which is 2400 Harbor Boulevard, Suite 7. She's right there at Bayfront Port Charlotte Hospital. And you can call her at 941 766 5099. That is her office number, and make arrangements to meet this lady in person and get evaluated for any conditions that you're having. Doctor, thank you so much for taking time out of your day to come on the show and to tell people about what you do. Thank you for coming to our area.
Thank you.
We'll see you next week on Making